everybody. It's Tuesday night. It's 7 o'clock and we are live. Hello, everybody. It's Tuesday night. It's 7 o'clock and we are live. Welcome to Detox. I'm your host, Veronica Brockwell. Well, it is that time of the month where we have Dr. Michael Wild on our show. And the topic this evening is going to be hypothyroidism. For those of you who don't know who Michael is, he is our regular physician. He is a chiropractic physician, a functional medicine practitioner, and certified inflammation and detoxification specialist. That's a lot. And he is with us tonight, and I'm always so excited when he's on the show. He's so smart. Hi, Michael.
Yeah.
It's true. I know. Do you remember? I couldn't say detoxification.
I was very proud of you. You've been saying it very well. You're used to it now.
I know. I learned so many big words with you.
Well, here I am again. And it's not a hairy chest. It is Ralphie. He's making his appearance again.
I was going to say,
lap as usual.
It looks like you're like a dude from the 70s. I was like, what's happening over there?
Boom, chicka, wow, wow.
I know. Right? I know. You're missing your chain. How is Ralphie?
Ralphie's great. Ralphie is very secure here in my lap and enjoys that I pet his head this entire time. So he's a happy-go-lucky little puppy.
No, that's awesome. So I'm so glad you're here. We have chosen the topic of hypothyroidism. And I know you have lots to say on this topic. I know a lot of people suffer with symptoms associated with it and maybe don't really realize what it is or don't bother to get it checked. So
yeah, you're absolutely right. That's
spell that right? Hypothyroidism.
Yeah,
okay.
Yes,
all right.
Hypothyroidism is extremely common. Tens of thousands of people get diagnosed with hypothyroidism every year, and many don't realize they have it and actually don't get diagnosed. There's a lot of undiagnosed. A lot of doctors don't recognize the signs, and we attribute it to other things because your thyroid is a master gland that relates to pretty much one way or another to all the other major glands in your body. So you can have symptoms.
And where is it located?
So it's right here in your neck, right?
Mm-hmm.
So if you come down, you kind of squeeze a little bit firmly, you could feel the cartilage in your throat, right? The kind of the hard rings.
Yeah.
You come down and you get to your voice box down here and the cartilage that covers that. And that's kind of a bigger area. And it's right around that. It's in a butterfly shape.
Okay.
Right here. Now, if you can palpate that, if you come off those hard rings and you feel something kind of squishy in there, and you can actually, if you can actually feel it go up and down and you feel something a little squishy right down the very bottom of your throat, that's your thyroid gland. And if you can feel it, that's a problem because you shouldn't be able to.
Okay.
Right? Okay. So the only time you really feel it is when it's kind of inflamed.
Okay.
Right? And it's a little enlarged. If it gets really large and you can visibly see it, that's called a goiter.
Okay.
And if you think about it, if you use a muscle and work it harder and harder and harder, it gets bigger, right? Okay. So if you work that gland harder and harder, it gets bigger, and that's a goiter.
Okay.
And so sometimes we can see that, you can look at someone, but most of the time it's not visible from the outside, and you have no idea that you have a thyroid problem, yet you have all kinds of symptoms that actually are coming from a dysfunctional thyroid. And probably the most common symptom is fatigue, right? People just describe to me they have a lot, like just no matter how much I sleep, I just don't feel well rested and I can't stay awake at night. I just feel really tired and fatigued. And we also get dry skin from it.
Okay.
Your hair can get dry and start to fall out, especially the outer 1/3 of the eyebrows. So if you look in the mirror and you don't have full eyebrows, this is really starting to thin. That's a telltale sign of hypothyroidism.
Okay.
Another thing is cold hands and cold feet. And your fingernails can start getting rigid and break easily.
All right.
So another thing is difficulty losing weight. And when it's your thyroid, we tend to gain weight eventually over our entire body. So different glands that are associated with hormones relative to fat storage and fat burning, when they become out of balance or upset, and stress, they tend to create weight gain in certain areas. So, for example, if your ovaries are not functioning well, you gain a lot of weight around your thighs and your buttock. And that's why typically you're going to see heavier thighs in women than you will in men, because it relates to estrogen, right? And if you have a problem with your liver, you're going to get that basketball belly, that really distended, firm belly, but the rest of you may look thin, but there's that belly sticking out. As a matter of fact, when people drink a lot, we call that a beer belly, right? When in fact, that's because it's a beer belly because the beer and alcohol are affecting your liver. It's actually a dysfunctional liver that's causing your belly to become large like that.
Okay.
Right? When it's your adrenal glands, your stress response, and you're overly stressed and it's related to too much cortisol, your stress hormone causing fat deposits, that forms right in your abdomen and your belly again, but more like a muffin top, right? And, we've talked about that before, right? We've done that on the muffin top, right?
We don't like the muffin top.
Right. So when your thyroid gets involved, because it interacts very directly with all the other major organs and glands, your thyroid can get involved, your liver can get involved, your adrenals can get involved, your ovaries can get involved, and you start to kind of gain weight overall.
Okay.
So if you're starting to get a little heavier around your throat, around your arms, around your belly, all around the same time, that's usually your thyroid, but that's kind of the end stage of it. So you may not notice all that happening at once, but if it goes on for years and years, then you start gaining weight overall. So weight gain that is hard to get rid of is definitely thyroid related.
Let me ask you a question. If you suspect that this is happening and you get a blood test, would it always show, like if the doctor, would it always show if your thyroid wasn't functioning properly? With
So
like
no,
a basic test?
Yeah, as a matter of fact, that was a great question because so many people come to me and say, I have all these symptoms you're talking about. And it even affects insomnia, and brain fog is a big one.
Yeah.
I feel like I just can't think straight, right? So all these kind of weird symptoms like that. And they go, hey, I went on Google, I looked up, I've got a thyroid problem, but I went to my doctor and they said they checked my thyroid and my blood work was normal.
Right.
How could that be?
How could
And
that
the
be?
reason for that, right, is that oftentimes most doctors are not doing nearly enough blood work to look at your thyroid. So the most common thing that doctors look at is called TSH, or thyroid stimulating hormone. And that's the gold standard test to look for when someone's evaluating your thyroid. Now, the funny thing is, it's not even a thyroid hormone. It's a brain hormone.
Okay.
So you have a master controller gland in your brain called the hypothalamus. And the hypothalamus is kind of patrolling all the levels of everything that's going on in your body and seeing what's too high, what's too low, what needs help. And if the hypothalamus detects that your thyroid hormone is too low, which would be hypothyroidism or low thyroid, it's then going to give a nudge to its second in command, which is also in your brain, called your pituitary gland. And the pituitary gland releases a couple of different hormones, okay? But one of them, a big one, is TSH, thyroid stimulating hormone. And that stimulates your thyroid to make more hormone. So the pituitary is releasing TSH. So if you measure your TSH on your blood test, all it's really telling you is your pituitary talking to your thyroid? It's not telling you if your thyroid's getting the signal, or if your thyroid gets the signal and then makes thyroid hormone, is your body able to use that hormone? Right? So there are actually many steps to this process. And you really have to look at a number of factors to tell if your thyroid's working right. I do a thyroid panel with my patients that looks at 11 things, okay? And I really feel all those things need to be looked at to really get a fuller picture of whether your thyroid's actually working right or not, because those things evaluate not only the pituitary talking to the thyroid, but the thyroid itself. Is it making the right kind of hormones? Are those hormones being freely available to the body, or are they being wrapped up in a protein and not being able to be used? It's like a present you can't unwrap, okay? So we got to look for those things. We talked before about your adrenal glands and cortisol being involved in creating that muffin top.
Yeah.
When you have too much cortisol in your bloodstream because you're too stressed for too long, that actually attaches to your thyroid hormone and bonds to it and turns into something called reverse thyroid hormone, or reverse T3. And that reverse is a mirror image of the real thing, and it clogs up your cell receptors as if it was the real deal, but it can't be used. is like an imposter. So there's lots of other ways in which this can go wrong. Your thyroid makes two different kinds of hormone called T4 and T3.
Mm-hmm.
And the numbers relate to how many iodine molecules make up that hormone. So if it's T3, it's 3 iodine molecules. If it's T4, it's 4.
Okay.
So iodine is often important for thyroid function. And if you don't have enough iodine, it can create a problem, which is why they started adding iodine to table salt years ago. You'll see it says iodized, right?
Mm-hmm.
You may never think about what the heck does that mean. It means they added iodine so that your body could make proper thyroid hormone, because for a long time it was not readily available in our diet. And so they had to add it back to the thing that most people were using at their dinner table every night, which was salt, right? So they started iodizing salt.
Okay.
But if you have a particular kind of hypothyroidism, which is an autoimmune hypothyroid known as Hashimoto's, which is about 80% of thyroid problems, then taking iodine can actually be a problem. And if you take too much too fast, it creates what we call a thyroid storm, and you get much worse. So don't just automatically start loading up on iodine. As I told you, iodine is necessary for thyroid hormone. You really should do this under a doctor's guidance, see what kind of thyroid problem you have, and make sure you're doing the proper protocol to help your thyroid work better, not just throw a bunch of stuff against the wall and see what sticks. Okay.
And you said the name of that disease or disorder is Hashimoto's?
Hashimoto's thyroiditis is the full name. It's commonly referred to just as Hashimoto's.
Okay. And what kind of tests do they do for that?
So your average doctor doesn't test for it, because your average medical doctor, even your average endocrinologists, simply treat all hypothyroidism the same way. There are actually 27 different patterns of hypothyroidism, yet they're all treated the same way medically, which is to give you synthetic thyroid hormone, most typically Synthroid, or another form of it called levothyroxine.
Mm-hmm.
Okay. And unfortunately, because they're not digging deep enough, my experience has been that most doctors think that's just going to take care of it, no matter what the problem is, because here we are, we're giving you Synthroid or levothyroxine, which is synthetic thyroid hormone. Therefore, I don't care what's wrong with your thyroid. I'm giving you the hormone. You should be fine. Right? Now, the reality is, as I said, what that is, as I said before, there's T3 and T4. Mm-hmm. And T3 is the usable form that your cells can actually ingest. It attaches to a receptor in your cell membrane that tells the cell what to do. So we really need T3 to actively attach to our cells for our cells to have proper metabolism. And thyroid hormone is important to every single cell in your body. It's basically the wake up, get up, and go signal. Okay. So it controls the metabolism of that cell and says, time to make more energy, time to do your job, time to do it better. So every single cell in your body has receptors on its cell membrane, like an antenna listening for a signal for thyroid hormone. And so we don't fully understand what it does for every single cell in full detail, but we do know it wakes every cell up. So we need thyroid hormone, and we need our cells to be able to receive and hear that thyroid hormone through its antenna or receptors. So T3 is that hormone. But when your thyroid gets that nudge by a pituitary with TSH to stimulate your thyroid to make more hormone, it makes a lot of what's known as T4 and a very little bit of T3. So T4 is the storage form or inactive form of the thyroid hormone. It's still wrapped up. It has 4 molecules of iodine. Four, there we go. And we need to take one of those off in order for it to be activated and to go towards the cells. So in order to cleave that extra iodine molecule off, you need the right cofactors or nutrients present in the right amounts at the right time to do that. And some of those are things like vitamin D and selenium. And if you don't have those in the right amounts, you can't activate your thyroid hormone from the packaged T4 state into the unwrapped T3 state. Mm-hmm. And that unwrapping takes place in your liver, in your intestines, and in your fat cells. So if your liver is stressed, you can't do it as well. If your digestive system is stressed, you can't do it as well. And if you don't have the right balance of fat cells and type of fat cells, you can't do it as well. So there's lots of places this can all go wrong. right? And yet that TSH will still show you're normal. So it gets a little tricky. So by the time things start to really hit the fan, your thyroid most commonly is going wrong for 10 to 20 years before things really start showing up in your blood.
Wow. Okay. And here you are not understanding what's going on with your body.
Right. You're
You
frustrated.
can't get answers.
Right.
And you're just getting old.
Right.
Your metabolism is just changing.
Right. It's in your head. We checked your levels. You're fine. Right. Well, I'll tell you right now, it's not in your head. It's just a few inches below that.
Yeah. Right.
Okay. So something is affecting the way that thyroid's working in your body.
So I have a question. I want to kind of jump on to thyroid nodules and how they develop, and do they affect the function of your thyroid?
Okay. And I know I'm talking about something personal to you right now, because you did express to me that you had discovered you had some thyroid nodules, and you were concerned about those, right?
And they were found out accidentally.
Right. Okay.
Because I had already had my thyroid hormones checked.
And they said they were?
They were perfect.
Right. Okay. So they weren't checking the full picture, so we're not really sure. And then when they examined your thyroid and they started feeling around on there, right?
No, I had a CT. No, I had a CT scan. I was in the hospital when I was sick with COVID, and they had done.
It was a by the way kind of finding. Did you know that you have these nodules that you can't feel? And your blood work didn't show?
Can't see them. No.
Right. Okay. So nodules are a type of growth, and that can be benign or not. Right. And benign means good, and not is cancer. Right. So typically what they're going to do is they're going to do a needle biopsy first and see if that little part they sucked out can spit out into a petri dish some cancerous cells. Right. Now, a lot of times that may or may not be helpful, because they may not get a large enough sample to do that. And you don't want to go in there and keep poking away with a needle, because now you're creating inflammation. You're creating a problem in that gland that the gland is going to respond to. That can grow something if you do it too much.
Okay.
Right? And also, when there is cancer, certain kinds of cancer do something called seeding. So you poke into the growth with a needle and then you draw it back out. Well, let's say that was cancer. And so now you're stuck right into the middle of it. So you suck some into the needle and some cover the outside of the needle. And as you pull it back out, you're dragging that along with it.
Awesome.
And you're seeding cancer cells, right? So that can happen in certain kinds of growths and certain kinds of cancer. So there's a determination made. Is it worth doing that? Do we take that chance? Should we do that? Should we go in and cut the nodule out and further examine that, right? Because now you have a bigger lump to look at, and you can actually do a more effective biopsy and see what that is, right? Now, the problem is, because the thyroid is it's a small gland, it's a little gland down in there. They get concerned that they can't see it all, right? So maybe there is a nodule, and maybe it is cancerous, and maybe it's got like roots that go out behind it into that whole gland or a whole half of the gland. Because a lot of time the gland looks like a butterfly and it's kind of split down the middle, and they'll find cancer in one half but not the other. So if the nodules are only on one side, they may recommend removing that whole half of your thyroid in order to get a full understanding of what's going on there. But there's a chance it's not cancer at all. And now you're removing half your thyroid, and that can produce a problem, right? Because I just explained, your thyroid kind of connects to everything.
Yeah.
And thyroid hormone is so important to every cell. So unfortunately, a lot of people get told, well, we'll just take it out and we hope the other half can just step up and do the job. And if it doesn't, we're just going to load you up with Synthroid or levothyroxine. And you should be okay because we're just giving you a thyroid hormone. The problem with that approach is when they give you that medication, they give you that synthetic thyroid hormone. If your body, so Synthroid and levothyroxine are all synthetic T4. They're all the storage form. So if your problem is that your cells can't hear it, or there's too much cortisol, or you're not actually converting it properly in your liver or your intestines, then you really can't use that T4 really well. So they can give you a lot of synthetic thyroid hormone, but you still can't use it as well. So you might still end up with a lot of problems. So that's not the answer all the time,
Right.
right? As I was saying, there are 27 different patterns of how your thyroid can go wrong. And really, Synthroid and levothyroxine work really, really well for one of those 27. Okay. When you have primary hypothyroidism and the gland itself truly has just stopped making the hormone, everything else is working just fine. You can convert it, you can use it, your cells can hear it, but you just can't make it. In that case, in primary hypothyroidism, then the synthetics work okay, right? Then it just comes down to, am I taking enough? Because your body's always going to change its needs. And so when you're taking the medication, it's a best guess. You never really know exactly what your body needs in a given moment. So you're always too much or too little. You're never just right. So it's a balancing act, right? And trying to figure that out, kind of like a diabetic trying to inject themselves with insulin. They have to monitor their blood all the time. Where are my levels? What's my blood sugar doing? Do I need more? Do I need less? And they still screw it up.
Yeah, right.
So, it's a little bit of a crapshoot. So if you have nodules, trying to figure out, are they benign or cancerous, is a little bit tough to do sometimes, right? So because certain types of cancer, and you and I were just talking about this before we went on, especially in the thyroid, can be very, very slow growing. Sometimes a wait and watch approach is a little bit better, right? While doing things to reduce inflammation in your thyroid, which, whether it's benign or not, is involved in growing those nodules.
Right.
There's inflammation of that tissue. So there's abnormal growth response going on in reaction to abnormal signaling coming from that tissue, which inflammation causes.
Well, it's interesting for me is that my baseline is after I got off sugar. So I don't know what these things looked like.
Right. What was happening last year, the year before, right? What was going on that actually set in motion the process that created these nodules.
Right.
So you're looking now because we've been working together and you're really improving things.
Yeah.
So we know that now things are getting better, but what grew this in the first place?
Right.
Right? Because stuff doesn't just pop up. We may just see it suddenly, right? But and I'm not saying yours is cancer, but the average cancer.
We don't know. They don't, they said 50-50 after all
50-50,
these tests. So
right?
there's a 50% chance they take out half my thyroid and they're like, oh, sorry.
Right.
It was fine. Right.
So that to me, and again, I'm not telling you what to do. It's your own body, and that decision is between you and your doctor.
Sure.
But for me, I would not rush to remove my thyroid. I would do things to reduce inflammation at the cellular level and help that tissue function in a healthier way while monitoring it regularly to see, are those nodules getting bigger? Are there more nodules? Because if it's growing with the stuff I'm doing to help control things, now I'm more concerned. Okay.
Right. Sure.
And then I'd be more prone to thinking maybe I do want to remove that half. Right.
Right.
Now, another thing you can do is there is an enzyme test called the Nagalase test. And that's Nagalase. Nagalase. The Nagalase is an enzyme that's released from your cells when there is a serious viral attack going on or cancer. Okay. And so your immune system usually keeps those two things in check. It won't let viruses get really bad and it won't let you get cancer, right? So when your body's operating normally, there should be a really small amount of Nagalase in your bloodstream, just normal cell death kind of stuff and things going on. But if your immune system is weak and it's letting things get out of control, like letting cancer grow, we're going to see a lot of that Nagalase come up in your bloodstream. So a Nagalase blood test is one way to tell if you more likely than not have active cancer somewhere in your body.
Interesting.
Right? It doesn't define for us where or what kind or what's going on, but just says, hey, there's way too much of this enzyme in your bloodstream, and it only comes from two places, right? A really strong bad virus or cancer. And generally, if you have that really strong bad virus, you kind of know it.
Oh, does it have to be active in your system, or
so usually if you have something like that, you're going to have some kind of symptoms.
Like, like if you had COVID 6 months ago with that, it
You
would
know,
be too
so
soon
COVID is too new
to take that test,
to kind of know if
Mm.
that's going to impact things. Like generally, you see it with serious diseases like HIV, um,
Right.
serious hepatitis,
Mm.
things along those lines, where you have definite symptoms and you know something's not right and it's long term. So there's potential that COVID
Mm.
could do that, I would think, right?
Sure.
But I don't think that we know enough about that yet to know with that. But what I would do is if I had suspicion, I would at least run that test, see where my numbers are, and I would wait and watch. I'd run that test again 6 months down the road. And is that number going down? If it was high, is it going down? Or is it continuing to climb? Because if I'm no longer sick that I'm aware of, and that number still climbs, something's going on.
Right. Exactly.
Right.
Is that a test you have?
It is. Yeah, I do that in my
Okay.
office.
Okay.
Um,
You'd have to
I
go to I have to go see you.
Well, you can do it in my office, or I can mail you a test kit to do it. Well,
Oh,
actually, it's not a test kit. You would have to actually go get your blood drawn for that one.
I
I would
don't
send
I don't
you.
mind the trip.
Well, you should come down visit.
I know. I
Yeah, come
always
on
say
down.
I'm coming. I really do need to go. Yeah.
We're gonna have a party. Like my family was just here for Thanksgiving, right?
Yeah.
So my brother and his sons and my mom came down, and my mom's been cooped up ever since COVID, really afraid to travel, and it took a lot of arm twisting. But I got her to come down here for Thanksgiving and enjoy Thanksgiving with us.
Wow.
I said, Mom, these are the people you're around. My brother and his kids all the time. So what difference does that make? And you're going to be down here just with me, and I come up there and see you fairly regularly. So, why not come enjoy Thanksgiving? And so my mom's number one priority was not come and enjoy Thanksgiving with her son. It was, well, if I'm there, can you run lab tests on me? Right.
I know. Hey, can I come see you and go to the lab and run some
Right.
tests?
So we actually had a fun day at my office on
Awesome.
Friday, and we spent a couple hours there playing with
Right.
all my biohacking toys and doing
Right.
treatments and running lab work and doing all that fun stuff. So soon I'll get to tell Mom what's going on with her. And I was doing some advanced testing for her immune system to
Uh-huh.
help put her at ease, right?
Yeah.
To know, is she strong? If she's not, where is she not? Why is she not? Because I know how to fix it. So I said, Mom, let's just find out where you're at. And if things aren't good, I'll tell you how to fix it. And within a few months, you'll be good.
Right.
Right. And if you are good, then you can relax a little bit. Okay. So, I'm really worried about people's psyche and what these past couple of years have done to everybody, and the fear and anxiety. And that's so much more damaging to you. And that lowers your immune system. So I know we spoke about that before as well.
Yeah.
So anyway, we did some lab testing on Mom, but I thought that was kind of funny. I really think that she was more, excited about doing that than she was coming to visit, but that's okay.
I know.
If that's what it takes to get her here, that's what I'll do.
So, well, we look forward to hearing about how healthy she is.
That's right.
Because I know she is.
And that Nagalase test is not one of the ones we did on her because I wasn't concerned about cancer for her. But that test costs $199, right?
Yeah.
So it's not outrageous. I'm not saying it's nothing, but it's well worth it. If you have any concerns, I think it's well worth it. And you get a baseline. And if that baseline is abnormal, then we start doing more digging and looking for other markers of cancer or viruses, because there's other markers you can do to look for that, different antigen markers for the more common types of things that could be in your body, and try to pinpoint where that's coming from. And then most importantly, no matter what, we start working on getting your body to a healthier state, right?
Mm-hmm.
We don't just sit back and wait and watch and do nothing. No. We wait and watch, meaning monitor what that's doing. But in the meantime, we take steps to improve the baseline health and the functioning of every cell, because that makes up the tissues that make up your organs and glands, right? Mm-hmm. So I would, of course, put you on a specific protocol to help your cells go through a healing cycle and start to help no matter what it is, right?
Right.
But we want to have these things to monitor so we know, well, how much progress are we making? And have we reached a point where everything is really okay now? Can we start to back off? So I think it's important to kind of have baseline labs and know what's going on while you're doing this kind of stuff, just to know what kind of impact is it having. Are you being successful? Right?
Yeah. I love your approach because, we've talked about it before, but you go to the doctor and they just, okay. They told me that I should just take out half my thyroid. Like they wanted
And
to schedule, and they did. They're like, oh, we'll just take out half your thyroid, and then it'll be fine, and
right, like it's
we'll
nothing.
dissect it, and I'm sure the other side will pick up the slack. And if not, we'll just put you on medication. And I'm like, but it's 50-50. Like you've not found any cancer so far.
Right.
It's just a little suspicious. But you're going to take out
Yeah.
half my thyroid, which I can't put back.
That to me is a very radical approach. I understand they want to, they're concerned
Yeah,
about you and they want to cover,
yeah,
they want you to be safe and they want to cover their butts too. They don't want
yeah.
to not do it and not tell you to do it. And then you come back later and say, well, it was cancer and you didn't push hard enough and now I'm going to sue you.
Sure.
So,
Yeah. And I get that.
right. Unfortunately, that's the world we live in nowadays, right?
Yeah.
There's so much litigation that doctors have to be so concerned about that. They can't err on the side of what I consider erring on the side of caution to me would be not to take it out just yet. Right.
Right.
And their erring on the side of caution is we better take it out. Right. So
I was just so surprised that there wasn't like a level between that. It was
right.
just like I get this call the day before Thanksgiving. Yeah, it was 30% chance when they did the needle biopsy, which I didn't know. Now you're telling me this, now I'm all worried. They did the needle biopsy, and it was like I think it came back like 30% chance that it could be cancerous just because it looks suspicious. And then they sent it off for genetic testing. And then those numbers went to 50. I'm not sure what happened at that place. Maybe you could explain it. But it just was curious to me that there wasn't like, okay, let's look at this over the next 6 months. We'll check, see. It was no, like we should just schedule you now and have it taken out.
Right. And so I'm
yeah.
sorry, I don't mean to worry you. And I just explain that process. And,
yeah, no, it's fine.
I'm
tough.
I think that, so the difference there, what happened was when they looked at the needle biopsy, they could see under a microscope abnormal cells, right? And they could see patterns of things that didn't look right. But not necessarily that it was full-blown cancer, but it goes in stages, right? So you start having things start to look a little wonky and they start to mutate and they continue to grow. So you can have abnormal cells. We have abnormal cells all the time.
Yeah.
Right. And our immune system just then goes around and destroys them, right? Because cells become abnormal when they come up against toxins in our body that were sucked in from the environment. They become abnormal when they're just dividing themselves, yet something goes a little bit off. And so you get a bad copy. Right. So those are called genetic transcription errors. So the DNA gets a little funky. So there's different things that can happen that can mutate. And so we have what we call precancerous cells. Right. And so we say they don't look right, but there's not enough going on that we would call it cancer. So that's kind of what I think they were originally probably saying with that 30% chance deal. Okay. And then they said, let's send that tissue out for genetic testing because they look for certain genes that say, well, when you have this plus this, plus this, plus this, then that is a very likely chance that this will evolve into cancer. Okay. So you can have certain genetic blueprint that says, if you have these guys present, it's usual that they're going to go this way. Right. But again, this is all a little bit of a crapshoot. Okay.
Yeah.
So even the genetic blueprint doesn't mean that's what's going to happen. That's why I said, well, now it's 50-50. Well, just about anything's 50-50, right? I mean, I could flip a coin. It's 50-50, right? So,
let's just see.
It's kind of like the weatherman, 50% chance of rain. Well, he's got it right no matter what.
Yeah.
Right?
So I think, for a lot of people, they're never going to know if they have a thyroid nodule or not unless you can feel it or you have a test for it.
Right.
You can't see this.
Right.
You cannot see it. I had some symptoms of hypothyroidism, which I went and got tested and they said everything was fine. This is before they found the nodule. And then they said, I have a nodule, and they said, but the nodule doesn't affect the function of your thyroid. So is this true?
So it depends on where the nodule is. It depends on the size of the nodules, the number of nodules, right? So like in your case, we were explaining that's on the outside of the gland, superficial, right? So it's kind of like a bubble
I
attached
think it's
to it,
in. I think it's in. It's
right
just at the
inside
top.
with the top.
It's at the top. I actually
Okay.
have 3 nodules,
Okay.
but the other ones are fine and very tiny.
Okay.
So,
So they can be on the outside. They could
okay.
be just on the inside. So if they get large enough, they can disrupt the thyroid function.
Okay.
Okay.
This is
But
about an inch diameter
yes, of
inside
a
the
certain
thyroid.
size and location may
Mm.
not affect the gland
Okay.
as much. Um, and sometimes when it affects the gland, it can make too much hormone,
Mhm.
right? So if it's more thyroid tissue being created that creates the hormone, you can end up with too much hormone, or it can start to become dysfunctional and not function, then you end up with not enough hormone. So it can go either way,
Okay.
right? So, for example, talking about finding things you didn't know were there,
Mm.
I guess 6.5 years ago, I crashed my motorcycle and I got pretty bashed up, right? And so I had broken my pelvis, I broke 6 ribs, I collapsed my left lung,
Oh, no.
and while I was in the hospital getting a CT scan to evaluate all that, they didn't even mention it, but I was reading the report, and oh, and by the way, you have a fluid-filled cyst on one of your kidneys the size of a baseball, right? So they didn't even mention it at all. I just read that
What?
report because it's an outside. It's like when you get a blister at the beach, right, from the
Mhm.
sun, and then if your skin starts peeling, you ever go in the water and you kind of come out with these like water pockets? Have you ever done that? It's kind of nasty. I don't know if you've ever done it, but I've done it, right? So if your skin starts
Mm.
peeling and you go back in the water and you come out, it kind of like fills up and it's like a big blister, right?
Yeah, no, I can't say that I've experienced that. I'm sorry.
Wow. Yeah, I fell asleep
And
in the sun.
and and glad.
I thought,
Yeah. Yeah.
one, I'm not advocating, getting sunburned to the point of blistering, but on spring break in college, we drove down to Key West, and the first thing we did was we got right on the beach, and we've been driving all night from Boston down, and we lay on the beach and just all fell asleep and woke up like 6 hours later. No sunscreen,
Wow,
just
yeah.
laying out. So
Mm.
I was completely lobster boy, right?
Yeah, sure.
So yeah, I did some serious damage to my skin at that time, and so when I dove into the water after the skin started to peel, I looked like I had these huge blisters. Well,
Mhm.
that big blister is a fluid filled sac on the outside of my skin, but that's not affecting my body in any way.
Okay.
Right? So this cyst is fluid filled on the outside of my kidney. Now, if that was inside my kidney, taking up space, pushing tissue apart, that'd be a different story, right? So you can have cysts and nodules that don't affect function at all, and some that do. It just depends on where they are, how big they are, what they're pressing on,
Mhm.
right?
Right. Interesting.
Right.
All right. Well, I
So
know what I need to do. I'm
yeah,
getting a bunch of tests done.
so I would recommend a couple
Yeah,
for you,
for
right, to
sure.
to see
Yeah.
what's happening and go a little bit deeper with that, just so we can kind of put your mind at ease, or
Mm.
if something is happening, so we can get active on taking care of that, right?
Right. Mhm.
And as you know, and you know my history with losing my wife to cancer and
Yeah.
the path I've gone down, I help a lot of people to prevent and stop and sometimes even reverse active cancer, depending on what's going on, because cancer is a process, right?
Yeah.
And we work on reversing that process, enabling the body to work the way it's supposed to and stop what formed the cancer in the first place. So sometimes that does mean you do need medical intervention to, let's say you had a growth that was pushing on something that was vital. Well, you got to remove that, right?
Sure. Mhm.
Um, but then we might want to be on a path towards healing and repair that's very directed towards working from the cells on up to make
Yeah.
sure that your body is functioning the way it's supposed to, so it can actually heal and repair from that abnormal process. So I would do very specific things, to help with that, right? And that's
Right.
not a quick fix, right? So we're talking like at least a year to follow that
Mhm.
process.
Yeah,
Okay, because
sure.
you got to rebuild things, right? But you want to be on that path rather than not.
Yeah, and I like to share my stories on the podcast, just hoping, that it will help someone. And I
Right.
love having you here because you give a little bit different perspective, and you look at more of a holistic approach and a preventative approach rather than
Mhm.
just, all right.
Right.
Get rid of it. Well, what's causing this?
Exactly. And that's one of the, unfortunately, that's one of the shortcomings of our traditional medical system. We're really great at crisis care, tops, right? But we're really kind of crappy when it comes to true healthcare or looking for underlying causes and actually doing something about the causes. We're much better at treating and managing than we are at curing anything. Right. And, even most of the medications we take, right on the bottle says for the temporary relief of, it doesn't say for the permanent cure of, right?
So, Michael, I have a question about, we talked a little bit about iodine before, and I noticed that was just Dr. Google, which I know we should never go down that path, but, we all do. So they talked about using iodine to treat hypothyroidism, and you were saying that actually can hurt you depending on the type of issues that you're having, right? But so I have very much upped my salmon intake, my wild salmon intake, and my omega-3 fatty acids. And is this something that I should continue to do? I mean, I feel like I should, but
yeah. So you're not getting a large amount of iodine directly from those things, right? So there's typically going to be some iodine found in fish, especially in shellfish and in algae that the fish eat. That is the actual source of the iodine that eventually gets into the fish, right? So, but what you're doing is to improve your omega-3 levels, to reduce inflammation at that cellular membrane level, and those are okay. What I wouldn't want you to do is start supplementing directly with excessive exogenous, which means outside the body iodine, right? Taking a lot of iodine drops. There are some iodine tests that you can do to determine if you need iodine. Now, iodine can be really helpful. Iodine can be really helpful, especially in breast cancer, right? In reducing the incidence of cancer and helping your immune system. So iodine in general is usually pretty good, but when we have that autoimmune thyroid issue, it can be problematic. You got to be careful about how you take it and raise up the amounts very, very slowly. So I've seen people who read something on the internet and said, hey, I saw that iodine was good for this. So I ordered this iodine solution. I just started taking it under my tongue. Then they went full blown into a really bad thyroid storm, right? And felt horrible because it was too much too fast. So I'm not saying iodine is necessarily wrong, but you just got to be monitored. You got to be careful. You got to do it right.
Yeah. I mean, I think what I'm hearing from you is, before you do anything radical like that, you really need to get the appropriate blood work and understand your baseline and understand what's causing it all.
Yep.
So, and you have all those tests.
Correct.
And these are tests that the doctors are not going to give you.
Unfortunately, typically not, because again, and I'm going to make a little, and I'm not trying to be rude, and I greatly appreciate medical doctors, but I find that, when you're a carpenter and your only tool is a hammer, everything looks like a nail, right? So what that means is if you're used to being taught there's one way to treat hypothyroidism, you're just going to use that same solution over and over. So why would you bother to test for anything else? You're not going to treat it differently. But the reality is there are very different treatments depending on what the actual cause of your thyroid problem is, right? So if my only tool was the same tool, I wouldn't bother. But I have many tools, right? Because my perspective is different. My approach is different, right? So with that, I wasn't trained to look at it the same way they are, and they're not trained to look at it the way I do, right? So, and I'm making a blanket statement here, of course, right? There are certainly many medical doctors who are trained the way I think, right? I'm not saying I'm the only one who can do this, right? But what I am saying, it's not the traditional approach.
Sure.
Right? So I'm going to give you a quick example. When my wife was towards the later stages of her life, and actually in her last weeks in the hospital, she ended up in the hospital because the pain medication they had her on, she was on tons of different narcotics because her cancer was in every bone in her body, except for 2 vertebrae, and she had massive tumors, and her bones were breaking left and right. And she was in incredible pain. Just, you can't imagine, outrageous pain, right? And that kind of stuff like breaks your mind. And so she was on tons of narcotics. And it got to a point where her brain actually put up a wall and said, this is too much. It's not going to let this in anymore. So it's called central nervous system rejection. And basically, it stopped her body from absorbing those drugs, and she instantly felt all the pain. And she literally kind of snapped. She was just screaming uncontrollably, eyes wide open, but could not see me standing in front of her. Her brain went to a different place. And so I took her to the hospital to try to control her pain. And after about a week, we were able to get it more under control in there. And then while we were there, I'm noticing that she's got all kinds of symptoms. I've been bothering her for a while. A lot of excessive weight gain. She gained like 75 pounds in like 3 months, and no one could explain it. Her hair was falling out. They originally said, oh, that's from your chemo. And we said, well, we're not doing chemo.
Right.
She never did chemo.
Okay.
So the kind of cancer she had would not respond to any kind of chemo anyway. And they told us that right at the beginning. So why would you do it?
Yeah, because
right?
Makes
so the doctor who didn't know that said, oh, that's from chemo. She's a cancer patient. We said, no, she's not on chemo. And they said, oh, okay, whatever. Her hair's falling out. Big deal, right? Her skin got real dry. Her nails started to crack, right? She started to get foggy headed. And I'm sitting there, and I deal with people with hypothyroidism all the time, but I was so consumed by her cancer and this huge elephant in the room that I didn't see the thyroid, right? And one night I'm sleeping in the chair next to her. She's in the bed. I'm in that oh so comfortable chair they give you in the hospital. And I'm sitting next to her sleeping, and it just in the middle of the night, bam, comes to me like, oh my God, check her thyroid amongst many other things, because all these additional symptoms that are making her so very uncomfortable. There was muscle pain, aching, all kinds of things that are all related to thyroid, that I ran all this blood work on her, right? And it came back that she was massively hypothyroid, the worst I've ever seen, right? So we talked about that TSH level earlier.
Yeah.
And when they checked your TSH, do you remember at all what they told you a normal range was? Right?
No,
Okay.
they just said, oh, your thyroid's fine.
Okay.
Yeah.
So what's considered typical normal range from the average laboratory in the US for thyroid TSH hormone is from 0.5 to 4.5. So if your
That
TSH
seems like
is
a big
0.5 and 4.5, we consider that normal. And it is a big range. And from my perspective, it's too big.
right?
Because if you look at any medical textbook, it'll tell you anything above 2.5 indicates there's something wrong. Now, the reason that our lab ranges go all up to 4.5 is because there's a lot of dysfunctional thyroids out there. And lab ranges are based on an average of people going to that lab, not based on optimum function. So if the average person going to that lab to get blood work done is above 2.5, but below 4.5, they're going to call that average normal, okay, because it's common. So that range is actually way too big. And medical textbooks will tell you that anything from 0.5 to 2.5 is okay, but above 2.5 indicates a problem. When I ran the blood work on my wife, hers was 278.
Oh my gosh.
All right. And this had been going on for a little while. Like I said, about 3 to 6 months that she started having all these symptoms. And again, I actually was attributing everything to the cancer too.
Yeah.
Because I knew it was screwing up her hormones big time. I assumed there was going to be weight gain, but I didn't really think that there was actual direct dysfunction of her thyroid. And when I did that, I mean, I was so upset with myself because I could have done things to help her feel better all along, right? And what I was going to do for her thyroid wasn't necessarily going to change the course of that cancer, but I could have helped her feel better. She was feeling horrible, right? So immediately, I brought that to her oncologist's attention the next day, and he said, wow, I would have never thought to look at that. Look at that. That's crazy. I'm going to get her some Synthroid. And I said, whoa. No. That's not the right approach. And he looked at me like, what are you talking about? I said, well, look at the other things I measured here. I didn't just look at her TSH. I looked at all these other things, the thyroid panel I would do. And I saw that the reason that she was having such a problem was because her liver was not functioning properly and she could not convert. She had 9 tumors in her liver at this point. Her liver could not convert that synthetic thyroid hormone, the Synthroid they wanted to give her. So they
Okay.
would be loading her up, and that would create even more of a problem because
Yeah.
she wouldn't be able to use it. It would back up and would further throw off the whole cycle. So what she really needed was something called Cytomel, which is
Mhm.
synthetic T3. And that's a
Right.
really rare thing for any doctor to actually prescribe because it's active thyroid hormone. And because thyroid hormone is so active in all your cells, they're kind of afraid to do it,
Yeah.
right? They figured, let's just give you the wrapped up form and let your body sort it out. There's no way her body was sorting it out.
Yeah.
So I tried to explain that to him, and he just looked at me like a deer in the headlights, right? And he said, I don't understand what you're talking about, right? And he said, I'm just going to give her the Synthroid. And I said, listen, just follow the physiology. That's not going to help her. And he said, well, that's all I can do. An endocrinologist could look at this deeper and probably do more what you're talking about. I said, great, please bring an endocrinologist to her room. You know what he said? Can't do it. I said, why? He said, endocrinologists don't come to the hospital.
What?
I said, what are you talking about? We need an endocrinologist. Yeah, when she gets out of the hospital, you can take her to his office. I said, seriously? You and I both know she's not getting out of the hospital. I'm just talking about getting her comfort in her last days. You can't, no one can help me with this, right? She's on crazy drugs, crazy painkillers, and that's not cutting it. But if we actually helped her thyroid hormone get in, that would actually help her feel much better. And they would not do it.
I'm so sorry.
Right? Broke my heart.
Of course.
I was so freaking mad.
I know.
They would not do it. And he did prescribe the Synthroid, right? So every time the nurse came in with a pill tray, I had to say, can I have the Synthroid, please? And dump in the toilet. I had to stop them from giving it to her every time.
I'm so sorry.
I don't know. I just don't know. I actually forgot about all that till we started talking about this.
Yeah.
And it was crazy.
I know.
It was crazy. And now what would happen if I wasn't there? I don't know.
I'm sorry.
It's
I'm really sorry.
It's bad. So anyhow, let's talk about something better. Okay.
Okay.
All right. So we're just talked about the fact that we have synthetic T4 called Synthroid or levothyroxine. We have synthetic T3 called Cytomel. There's also a natural form of these things, right? That comes from a pig, and that pig hormone goes by two names: armor thyroid or nature thyroid, right? And if you are diagnosed with a thyroid problem, you probably want to see if your doctor will put you on one of those rather than the synthetic Synthroid or levothyroxine, because with the armor thyroid or the nature thyroid, you are getting some of the active T3 your cells can use right away. Okay. Now that doesn't fix any of the other problems that might be going on, but you will feel better right away because you're getting a little bit of the active use. Because if you can't convert it, or you have a receptor problem, or you don't have, a healthy liver or intestines, that will still get in there, right? Now it's not enough to really make you healthy, but it's enough for you to start to feel a little bit better. So you can do that while you're working on getting healthy.
Right.
Right.
Yeah.
So that's something you might want to ask a doctor about. And usually you have to get that at a compounding pharmacy where they will actually create that for you.
Yeah. Fortunately, I feel fantastic. I don't feel sick at all, but I know there are people out there that are, going through a lot right now, that either they have nodules, they're concerned about them, or they have symptoms of hypothyroidism. And I just wanted to, put this topic out there because it seems very, very common.
Well, I'll tell you, if anyone watching this is interested in learning more, I do a 2-hour and 20-minute seminar on just this topic.
You do?
I do. And it's available right on my website.
I didn't know that.
Yeah. Right. So for a number of years, I was probably my city, Richmond's premier natural thyroid doctor. So that's all I help people with for about 4 or 5 years, because the word spread very quickly that I was helping people. And so even though I was looking to help people with all kinds of things, diabetes, cancer, heart disease, Alzheimer's, I got so flooded with thyroid patients, I didn't have time to take on any other new patients.
How did I not know this?
You never asked. Right?
I did not know this.
So
Okay. Well,
um,
gee, I'm in the right spot.
I was able to help a lot of people with
Gosh.
that, but I purposely stopped kind of marketing or advertising the fact that I would help people with that because I didn't want to be pigeonholed.
Yeah,
Right.
no, I got it.
And while that was great, and I want to help people, but I don't want to only help people with thyroid problems. I want to help those bigger diseases because I know that I can, and I know they can help themselves by following what I ask them to do. I just don't want people to get pushed aside. I just didn't feel right. I don't understand when they say, "Oh, I went to get an appointment with the doctor. He can't see me for 3 months." Seriously?
Right.
Right? I mean, I'll work through lunchtimes. I'll stay late. I'll come in early. If someone needs my help, I'm going to get there.
Right.
Right? 3 months? Are you kidding me? Right? So, in that same way, I didn't want to box out the people with cancer, the people with diabetes, people with heart disease, the people with autoimmune dysfunction besides hypothyroidism, because over 150 autoimmune dysfunctions, because my protocols help all of that. Right?
Mhm.
So I want to make sure I had some room for that. So I kind of stopped advertising or marketing or even accepting referrals for that for a period of time. But the information is still out there, and I am helping people with that now. So if someone wants my help, I will certainly do that. Right. And again, I do see people around the country. Right. And I do it just like we're doing it right here. Right. You don't have to come to my office for that. There's lab work I can send you out to do. There's tests I can mail to you at home. And then we can see what's happening and put you on a game plan, and we can do our consulting. Right. And get you back
Yeah.
on track.
And I am completely, I'm actually not really that concerned about it. I think it's going to be just fine.
Right.
So I'm not super stressed about it, but I want to make sure that I don't make any decisions that could really hurt me later on.
I agree.
So, but I'm more than happy to, I don't care if we talk about my tests on the show. If it helps somebody, gosh, that's all that matters. That's why I do the show anyway.
Absolutely. And you and I have both shared some pretty personal stuff on
Yeah.
here that I don't think either one of us were ever intending to really share with your thousands of followers, right?
No.
But
Yeah, right.
yeah, that's always been my opinion. If something that I'm experiencing that I've worked through can help someone else, I'm going to share it.
Sure.
I'm not going to keep that to myself. So
No.
that's absolutely something I'd like to offer, all of your listeners and people watching the podcast, simply go to my website, which is Dr. Wild Can Help, DrWildCanHelp.com. Right. And when you go there, first thing you see is a big blue button that says free consult.
I
Just
know.
click on that and you get 15 minutes to pick my brain and talk about what's bugging you and if I can help you or not, and I'll guide you and direct you as to what the next step should be. Right. So I
Yeah.
encourage everybody to do that. And all the tests we talked about tonight are available. Okay.
Right.
And then we can get that out to folks and we can see what's really causing your thyroid problem if you really have one. Right.
Mhm.
And what do you have to do to fix it? And I can explain to you exactly how long that will take, what will be involved, and what you can expect.
Yeah. It's a much better plan. I just there's so many people that go to the doctor and they don't speak up. They're afraid to ask questions and they just do exactly what they're told.
Right.
And it's not always the right decision, and there are other ways that things can be treated. And I just feel like it's important to educate people on these situations that there's maybe a proactive way or a proactive approach, and surgery maybe isn't always the answer.
Right. The way I look at it is surgery is obviously very radical. You cut something out, it doesn't come back.
Yeah,
Right.
you can't put it back.
Right. So, I think our society relies too much on that. We let things deteriorate to the point that either there's no other choice or it gets recommended early on and just gets done because you think, oh, that's a quick fix. I'll just do that. And the reality is there's no such thing. You're going to end up with some kind of problems. God didn't give you extra parts you didn't need.
Yeah.
Right.
Whole nother show, but like I lost things in my body when I was 18 and it affected and things got, I had surgeries that affected the entire course of my life. And that of
Right.
course now I've heard wasn't even necessary. you know? So
Yeah.
I just, I'm thank you so much for coming into my life. I don't believe there are any accidents. Um, and I'm grateful to you. I'm grateful to your commitment to the show and helping people. You and I align that way. We just want to help people. And,
Absolutely.
we have to thank our friend Lisa for putting us together.
Yep. She's a matchmaker.
She's totally the matchmaker.
She is.
Oh my God. We should give her a shout out.
Absolutely.
Yeah. Lisa.
Hey,
Oh, just Lisa,
sorry.
we're giving you a shout out. Mamie'sApothecary.com, right?
Correct. It's
Yes.
Maimies, apothecary, right?
Mm-hmm.
Big word, look it up, right? But mamie'sapothecary.com. And
Mm-hmm.
that is her local shop here in Richmond, but also online, where
Mm-hmm.
she has all kinds of great things to help detoxify your body and your home. Kind of like use this, not that.
Right.
And she's done a great job with that. I actually took my whole family there while they were down here as well. And it was,
Oh,
we all got to buy some cool stuff to help our bodies and help keep us healthier. But yeah, Lisa's a great person.
oh my gosh, the
That has
nicest.
but really really brought a lot of people together
Yeah.
over the years. And I call her the mayor of Richmond because I feel like anywhere that I'm ever out with her and a group of friends, everyone knows her, right? Everyone walks up and says, "Oh my God, you made such an impact in my life." And she's so humble about it too. She's like, "What are you talking about? I did that little thing. You mean I introduced you to the president of the United States? That was
I
just one."
know. I know.
Yeah, I mean,
She knows
she does.
everybody.
She knows
It's
everybody.
hilarious. It's hilarious. I love hanging with her because I just meet so many people.
Absolutely.
And of course, she sent everyone to the prom because she has Lexus of Carytown. So every single person that went to prom
Yeah.
over the last 20 years has been in her dresses. So, or
Absolutely.
maybe probably even longer than that.
Yeah, she's been in
What year
business
is
for
it?
about 25 years, I think.
Right.
Yeah,
Exactly. Yeah. A long
right.
time.
So yeah, she's been supplying Richmond and far surrounding areas, even as far up as New York, I know, and
Yeah.
with the finest in prom dresses and
Yes.
formal wear through that store as well. So she's got the two
I
different
know.
businesses.
All right, Lisa, we've given you a huge shout out to end the show. All right, my dear. I will we'll chat. I'm gonna give you a call this week, and
Okay.
let's get a plan together. I'm gonna order some tests. I actually think I'm gonna buzz down and see you. I think that's the best way to do this.
Yep.
So I wanna get on it, and we'll come up with a great topic for next month.
Okay. Sounds like a plan.
All right, my friend. I'll talk to you later. Thank you for all of your help.
Thanks for having me on again. I really appreciate it.
All right. Bye, Ralphie.
Yeah, Ralphie ran away, and now Knight wants me to play. So
All
it's
right.
time to play.
Go play. And it's probably time for him to eat.
It is. All right. We'll
Okay.
see you
Bye bye.
later.
All right. Bye.
Bye-bye.
All right, everybody. Thank you so much for tuning in and listening to our conversation with Dr. Michael Wild about hypothyroidism. Next Tuesday night, the 7th, we have singer, songwriter, country singer, Grace Morrison. She is going to be on the show. She's been on her US tour for the last few months, and she just released her album, Daughter. And I haven't seen her, and I know all her fans are wondering what she's up to right now. I know she's just making music videos, and she's fabulous. And so we're going to have her on next week at 7:00. She's going to bring us up to speed, sing a few tunes. And then I'll also be talking about, we have a new expert coming to VTalks who's going to be a monthly contributor. And her name is Dr. Taylor Wells. And she is a psychologist and a law of attraction coach. And we are going to be covering different topics monthly. So she's going to be hosting the show with me. I'm so excited. She's been on the show before. She's been a guest on the show before, but she's actually going to be with us every month. And I think our topic is going to be dealing with holiday stress, which I think is a really wonderful topic for December. So anyway, thank you so much. And we will see you next Tuesday night. Bye-bye.